For every 10 micrograms of vitamin K2 in your diet that you take, there's a 9% reduction in cardiovascular risk. I take that any day. Show me which of my medicines can do that. So if you're consuming 40, 9 times 4, I mean, that's almost 50% reduction in cardiovascular risk. Patients with low vitamin K2 intake have the worst coronary calcification, and those with the highest had the lowest amount of coronary calcification. There's another Dutch study that was done, and they looked at vitamin K2, and it showed not only cardiovascular risk reduction, but these patients had less fractures, strength of the bones as well. This was a 2007 study. Then there were further studies done that the patients who were given vitamin K2 supplements, they had improved pulse wave velocities and carotid artery distensibility. So what does that mean? That means it's improving the elasticity of the blood vessels. How does it do that? Well, obviously, if there's less calcium built up in that artery wall, in the smooth muscle, which I explained to you before, then that artery is going to be more distensible. So if it's more distensible, what happens is that the systolic blood pressure will be lower. Because when the heart pumps into a rigid tube, the systolic blood pressure is going to be higher because there's nothing accommodating that stroke volume. But when there's more distensibility, that means there's more compliance in the blood vessel because there's less calcium, it's less rigid, you're going to get a lower systolic blood pressure. And we know that systolic blood pressure has a direct correlation to coronary artery disease, cardiomyopathy, congestive heart failure, and total mortality. So what happens to a diastolic blood pressure? Diastolic blood pressures. Patients given vitamin K2 supplements have a better diastolic pressure as well. Because you don't want a very low diastolic pressure. Because a low diastolic pressure decreases coronary perfusion, because coronary perfusion occurs in diastole. So what happens is, if you have vitamin K2 deficiency, you're going to get a high systolic pressure because of non-distensibility of your rigid tubes, your aorta and everything else. And you get a lower diastolic pressure because there's no recoil of the aorta, because diastolic pressure is caused by recoil of the aorta. So it's a double whammy. You don't want stiff arteries. You don't want calcium buildup. And by the way, this process of stiffening of the arteries and losing its elasticity starts in your 20s. So I hope I have your attention here. It starts in your 20s. By the time you're in the 50s and 60s, if you have not taken care of your vasculature, you're going to have stiff arteries, calcification. Yes, you may not have had a heart attack yet, but your physiology is being set up to either have a stroke, heart attack, or heart failure, leading cause of mortality in the Western world. So lots of studies have been done. Now, there's another study also with vitamin K2 supplementation. They took a cohort of patients, they gave them vitamin K2, and they found that the increase in the coronary calcium can be attenuated. So the control group showed ongoing calcification. It's so easy to do the coronary calcification scores. And here's a nice picture of it. It shows the calcium buildup again, just to remind you all. And this coronary calcification was attenuated. You could cause that slope to flatten out with vitamin K2. So you don't get more buildup. Compared to the cohort, the group that was given the vitamins had much less calcification buildup. So any opportunity to decrease the amount of coronary calcium and buildup in your arteries and to improve your elasticity and your distensibility of the vessels, take it. So I give my patients vitamin K2. And my diet has to improve. The further study showed that with cancer overall, this huge study showed a 30% reduced risk in cancer in patients who had high levels of vitamin K2 or equivalent in the bloodstream. And then prostate cancer. There was a study to show that there was less prostatic cancer and spread of cancer in patients who had the highest levels of vitamin K2 in their body, and osteodystrophy in renal failure patients. Now, one of the biggest problems with renal failure patients is that they get calcification of non-osseous structures. So when they come to me, oh, I see the coronary calcium score is extremely high, the carotids are calcified, the aorta is calcified, the aortic valve is calcified. And again, those patients used to be given calcium. We don't give them calcium anymore because the mortality is very high, and we feel that this is secondary to two factors, vitamin D deficiency and vitamin K2. Now, I've got to tell you about vitamin D at this point, because in order to get the optimal function of your vitamin K2, you also need vitamin D. Because vitamin D goes to that same matrix protein and then comes along the K2, and they work together on the matrix protein. So you need good levels of vitamin D as well. That's why we give vitamin D to our patients as well. So vitamin D's job in the body is twofold. One, it increases the absorption of calcium from your gut. That's what vitamin D does. But vitamin D doesn't then take it and do anything else with the calcium. That job is vitamin K2's job. Vitamin D's job is simply to absorb the calcium into your body. What the destination is for that calcium afterwards, whether it's going to go into a vascular structure or into the bone, that's not determined by vitamin D. That's why if you have a patient with osteopenia and just give them vitamin D alone, it's not really helping them. But if you look around you, everybody's on calcium supplements and vitamin D supplements, but they're not on vitamin K2 supplements. So this experiment has been gone long enough now. So in spite of, look, all your foods are vitamin D supplemented. There's vitamin D supplementation in your milk. There's vitamin D even in your orange juice. Just about anything you pick up is vitamin D supplement. And yet we have all this epidemic of 25-year-olds coming to me with osteopenia. Oh yeah, I have osteopenia as well. I'm surprised. And you're drinking all this stuff with so much vitamin D in it and calcium fortified. Everything's calcium fortified. And yet they're osteoporotic because they don't have the right chemistry. There you go. And by the way, vitamin K2 deficiency has also been linked to fertility problems.